side, I would stand.
Oh, okay, it makes sense.
Because it changes the angle for my wrists.
Oh, okay.
So that's known as a plunger. Okay, and this is the Gunn IMS technique on the upper thoracic. What we're looking for is shortened muscle tissues and connective tissues. In we go, and then we follow. Depending on the patient, the needle is. You can see there, the needle is in nicely. Yep. And we're looking for fibrous, shortened, contracted tissue, like there's a little bit in there. So we just put tiny little small holes. Doesn't hurt, Katrina will tell you. Not painful. You get the odd spot that's a little bit sore, but generally speaking, it's not as sore as it looks to be done.
Actually, it doesn't look as bad as I thought it was going to.
Thickened, shortened bit there. Actually going to bend my needle if I'm not careful, so just take it easy. There we go, started to get through, felt it through. And that's that feeling, is it just jumping and going into a good position. Good. Do about 7 or 8, 9, change the needle. Keep it nice and sharp. Get a bit of bruising sometimes, especially when you do it for the first or second time. This is the first time we've been up this high. And you can actually feel, before you even needle in this area, how thick this tissue is around that area. So there's a point on that right side, but we're going to do on the left to start with. Very thick.
Can you feel it?
Yeah. You can see it as well, so just the needle won't go through.
Yeah.
And then what we do is move around, and then suddenly, boom, it gives, and then it's ready to go.
Wow.
So it's called the Gunn IMS technique.
Epicenter.
Thank you. She lets me know when we hit the really fibrous thick bits. There's a point this side as well that you can see. We come in, lock it down so it can't move. Whoa, that's just really thick.
Yeah, you can see it.
Epicenter. Oh.
You're doing good.
This is really thick. Just take your time. In a minute you'll see it just give. Here we go, here we go. You feel it starting to give, and then it just gives away. Good. And then that's come out. All about safe angles, all about making it a safe technique.